Fox 23 News at 9, I'm Sunny Lee. Well, with the winter months here, lots of illnesses are making the rounds. You may have heard of a well-known global virus making its way back to the surface. Some call it the stomach flu, but doctors say the correct term is norovirus. Fox 23's Paris Rain is live in the studio after speaking with a local doctor about the illness and what you should do to keep yourself and your family safe from it.
Yes, honey, like you said, norovirus is nothing new. You usually hear about it running rampant on cruise ships, but the illness is spread most often from November to April, according to the CDC. Norovirus, an illness that reportedly affects around 2,500 people a year.
A virus that can infect humans very rapidly, and it causes an illness called gastroenteritis, essentially inflammation of the stomach, which is the gastro part, and enteritis, which is the intestines. And so it can result in nausea, vomiting, and diarrhea.
I spoke with Dr. John Schumann, an executive medical director at Oak Street Health, who says norovirus is different from COVID and influenza, also known as the flu.
We all want to stay safe, especially in the winter when influenza and COVID are going around and are pretty endemic. Norovirus is a little bit different than flu or COVID, for we do not have a vaccine for norovirus, for example. So there is no preventive. The only prevention is avoidance of getting infected.
So why do norovirus outbreaks seem so common right now? Schumann says for two reasons.
One is that we're more cooped up, and so being in confined spaces tends to increase the amount of infections in general. The second thing is that because it seems like people haven't been exposed to the variants of norovirus, that were kind of laying quiescent or dormant for a while people weren't interacting so much.
According to the Center for Disease Control's website, it spreads by having direct contact with someone with norovirus, eating food or drinking liquids contaminated with norovirus, and touching contaminated objects or surfaces, and then putting your fingers in your mouth. Dr. Schumann says the virus usually lasts for 1 to 3 days, but you can still spread it days after you feel better.
Most people can withstand this on their own and will get better on their own. But I caution folks who are at the extreme of age, being older or having many chronic conditions, being on a lot of medication, or if you're, for example, like I said, getting cancer treatment, those are folks who should definitely, at the very least, call their medical providers and get advice over the phone as to whether or not they should go in.
The CDC has posted this graphic on their website, reminding people to wash their hands after changing diapers, touching common surfaces, shaking hands, and caring for people who are sick. Well, I spoke with Dr. Schumann primarily about norovirus. I was surprised to hear he has bigger concerns about another illness. I'll have that story for you on Fox 23 News at 10. In studio covering News That Matters, I'm Paris Rain, Fox 23 News.
Now, the CDC has said that there are around 2,500 outbreaks of norovirus every year, and an estimated 900 to 1,000 people die from norovirus each year.